we approach any health challenge is we want to get to the soil, and we want to look at what are we missing in an underlying potential problem, not just treat a disease, and how do we correct things. So one of the first things we're looking for is nutrient deficiencies, because we know, for example, repleting the soil with nutrients can reverse hypertension and give your body what it needs to, the fuel to fight. So that's one of our important functional medicine tests. And in addition, we're going to be looking extensively at markers of inflammation, including insulin-like growth factor, which we want to keep very, very low, which you will with your excellent diet. And we want to maximize things like your vitamin D level, make sure your Bs are correct, your antioxidants are correct. So we'll be looking at where you are at this point in time and what we need to personalize for you, what we need to literally give you, okay? We'll also be looking at some genetic things like glucose 6-phosphate dehydrogenase. If somewhere along our journey we decide that you need some IV, high dose IV vitamin C, I don't mean 2 or 3 grams, I mean probably 50 grams. We need to know that you don't have a glucose 6-phosphate dehydrogenase gene that could affect that. So that's where we're going today with this. And one of the things we should absolutely consider as part of our journey is adding in some genetics. Yeah. And we have the ability to do a genetic sample. We can send a kit to your home. You just do a salivary test, and then that also helps us to match your genes with your nutrients. Yes. So it covers all those bases.
Amazing, amazing.
And the other functional test that we're very interested in doing is a stool test, because it tells us all about your microbiome, and the microbiome is fundamentally important to health. So that would be another important one for you at this time, a 3-day stool test. Okay. And Jeanette will give you the kit for that. I'll order the genetics kit for you, so that way we're sure we've covered all the bases.
That's great.
Okay?
Yeah, amazing, amazing.
All right.
All right, so we're going to go for it. You can videotape the. People like to watch. This is the part where some people like to actually watch you getting poked.
And if you don't like that, you may want to just not watch this part.
Yeah, this part exactly.
It's usually the men that are a little bit more squeamish. Women see blood on a regular basis.
Yes.
They're less squeamish about it. Are we going to do the right arm or the left?
We can do the left.
Left arm, good?
Yeah.
Okay, perfect.
Yeah.
Great. And then you're off to another appointment from here?
I've got to go home, and I'm going to be doing I'm doing an Awakening Conscious Leadership deep dive, a 3-day workshop, like on 2nd, 3rd, and 4th. I'm leading that, and I'm with a blessed team, and that's threading into the plot line as well.
Wonderful. Perfect. And okay. All right. We'll
So,
let
yeah.
you get your blood draw.
Yeah, and Amy, as you leave, I just want to.
I'm not going to leave. I'm going to wait for you.
But I just want to say,
Go ahead.
like, what you're doing over here is such important work. And I want people to understand how profound this is. You're healing me. You're providing this kind of foundational healing for me to do my life's purposeful work.
And and I know you acknowledge that.
Yeah.
That's all we're about, is our life purpose.
Right.
Right? And you're doing such amazing work with your leadership, teaching, and really teaching people how to change the way they think and to look at their emotions and process their emotions. And all of that is fundamental to health.
And you know what the beautiful thing is? So the program is called, and I know you're going to connect with this, it's like a serendipity, Awakening Conscious Leadership.
Yeah, exactly. And we talked for years about leadership, and we said, is it something that's learned, or is it something that people are born with? And I always thought that was an interesting question, because I think it's a combination of both.
Yes.
And stepping into consciousness and conscious leadership and awakening, and really looking at what is my purpose in life, right?
So that's, I'm just thinking how everything's, because that's actually, the threading of, it's not lost on me that the whole Health Institute journey, at the center of what they are offering is to connect patients with the purpose,
with their purpose.
for their health.
Right, and when we created the Academy, you and I, in a few years ago, we did that with the concept of bringing that to clinicians,
Yeah.
to renew their purpose in healing, to renew
Yeah.
their purpose as physicians, as nurses, as acupuncturists, because in the day-to-day we can get lost.
Yeah.
And we saw the deep need for healing and connection amongst the professionals.
Exactly.
So it goes both ways. You can't have one without the other.
Exactly. And so ultimately, the sad commentary is that 50%, even before COVID, of healthcare providers, that sample was primarily in physicians, have symptoms of burnout.
Yes.
So ultimately, we have a big commitment within the Academy of physician healing, resiliency, and well-being programs.
Absolutely.
Because it's ultimately about physician heal thyself before we can heal others.
How do we heal if we're not healed?
And it's not lost on me the suffering that many healers are going through during this
absolutely.
time of COVID, when the demands have never been higher and the resources have never
They've
been
been
more strained,
lower.
that people are kind of plummeting into a reactive frame.
Yes, and absolutely. So this is a perfect time for us to be having this discussion to say, don't give up. We're all in this together, and we're going to keep doing
that's
it.
good.
Okay, so you got our superstar blood drawer, Jeanette. So she'll take good care of you.
No pressure,
And the
Jeanette.
video doesn't even bother her. I'll step aside.
Okay.
Okay.
Can you make a fist for me?
Wow, you have some. That was glorious. I hardly felt that going in.
Oh, good.
You have got mad skills.
Thank you. It's always the plan.
Yeah.
You got a lot of blood to draw.
That's okay. Take as much as you need. So what are you experiencing as being a blessing in your day so far, or over the last week?
So far, so good. I'm healthy. My family's healthy. It's important right now.
Did you have a wonderful Thanksgiving?
Yes, I did. How was yours?
It was really a blessing. I mean, it's just so much has been going on that's kind of brought this has brought our family all closer together. So
Yeah.
when we're talking about Thanksgiving being about family and gratitude, we're living that right now. So it's actually,
good.
so we've experienced a Thanksgiving, but we're experiencing an ongoing Thanksgiving with actually
Yeah.
appreciation every day for the blessings of making every moment count.
That's true.
I'm just kind of thinking to myself that, I talk a lot in these videos about giving and receiving love, which is giving in and receiving from my heart, and it's not lost on me that I'm giving blood right now.
Yeah.
I'm giving of my heart right now. My heart is
Yeah.
pumping this and giving the gift that will actually come back to me, where I'll be the recipient of the wisdom of my blood test
All right.
that will serve in my healing process. How perfect a metaphor is that for I was talking about Tracy Gaudet, Dr. Tracy Gaudet, just most exquisite, most amazing woman. I just feel so blessed to actually truly know and connect with her. And she talks about what is the purpose for our health.
But I refroze everything.
And so she tells a funny story. I'm looking at the number of blood tests. So I think I've got time for a story.
Yeah, you do.
So
How many vials?
yeah. So when Tracy spoke at our conference, she tells the story. So just want to kind of have an understanding of how powerful this is. So she tells a story when she was at the VA about a patient who came in, and she had heart disease and diabetes, and I think she had arthritis. I mean, she was like, a typical suffering VA patient. And she came in and she got like a blood draw, much like I'm getting right now. She got a panel of labs done. And then she came back for an evaluation with the physician. And the physician wanted to actually show her lab test because, I mean, you can see this is an investment of time and pain. Well, not with your great touch, but, you know, so she came back and she said, you know, the doctor said, I'd like to go through your lab test with you. And she said, well, I'm not interested in seeing my lab results. I'm not interested in seeing my lab results. So you can imagine how the doctor was confused by that. Because, like, I mean, here, you know, we're going through this whole process of a blood draw. You've invested some time and effort and resources in getting the results. And she's not interested in getting the results. Like, how do you make sense of that? So she keeps going, like, the doctor says, like, what do you mean you don't want to see your results? I don't understand. So here's how she answered. She said, what most matters for the purpose of my life, what my health means to me, is that I have this vision of wanting to climb Mount Kilimanjaro. That's my main purpose for me right now in my life. That's my central purpose. That's why I'm invested in my health. And then she said, if you can show me how my blood test results will get me to the top of Mount Kilimanjaro, then I'm willing to look. But it needs to be in the context of purpose. It needs to be in the context of purpose. And Tracy has built a whole program around that to deeply respect not only patient-centered health, but placing, and I don't even, you know, when we talk about patients, it's not even the right word, placing purpose at the center of people's health. Like what, and as you think about this, think, what is the purpose? Why do you want your optimal health? What do you want to use your optimal health for? What do you want to use your optimal health for? And by the way, that's a perfect, it coincided with the end of the story. How perfect is that? Another demonstration of all the synchronicities that we've been going through this morning. You know, that's writing the cosmic script. That's flowing humbly and blessedly through me in service of you.